Our first movement pair is flexion and extension. Now these are more or less sagittal plane movements, and remember, we think of the movements as performed from the anatomical position. Sagittal plane. So, what joints perform flexion and extension? There's a lot of them. Heaps! Shoulder, elbow, wrist, fingers, hip, knee, not the ankle. The ankle gets a little bit tricky, but lots of joints do, and that's not all of them. The easiest place to look at flexion and extension is the elbow. So with flexion, the joint angle is getting reduced between the forearm and the arm. This is very typical of flexion. With extension, it's exactly the same movement, but it's just going in the opposite direction. Things get a little bit more tricky when you look at a joint like the shoulder, however. So notice in the elbow, you start, or in the anatomical position, the elbow is in full extension. It's only got one direction to move. With the shoulder, however, the anatomical position allows movement in both directions. So if you're from the anatomical position and you move your shoulder backwards or you move your arm posteriorly, that's extension. If you raise your arm upwards, that is flexion. It's important to note that the starting position of the joint doesn't matter. It's just the direction of the movement. So if you start from neutral, the anatomical position, and then move your arm backwards posteriorly, that's extension. But likewise, if you start in a flexed position and then lower your arm to the anatomical position, that's also extension. Let's have a quick look at how flexion and extension look in other joints. The knee, for example, is a little bit different. It's a lot like the elbow. In the anatomical position, it is fully extended, or very close to. But the knee is oriented in the opposite way. So when the knee flexes, the foot moves posteriorly and superiorly. The angle, notice, is still reducing. Same movement, just in a different orientation. Extension is just the opposite.